Chinese medicine as a medicine goes back thousands of years. Usually, Chinese medicine approaches any patient as a whole entity, consists of the organs and the relations between those organs, the function of the body. That's why the approach of Chinese medicine is totally different from the approach in Western medicine. The approach in Chinese medicine goes directly to the main source of the disease itself. But in Western medicine, we are more concerned with the symptoms, going back to the root of the problem, and sometimes we don't get to the root of the problem. As Chinese medicine, it consists of many branches. Many branches make Chinese medicine as the whole picture. The two main branches of Chinese medicine are a little bit far from each other, which is the first one is acupuncture, which uses needles to go into some points in the body, located points in the main map of acupuncture, which is about 400 points, and herbal medicine, Chinese herbal medicine. Both of them depend on the same method, which is the basic theory of Chinese medicine, the whole entity of the body. This theory. The other branches, they go hand to hand together with acupuncture or herbal medicine, like cupping, which is 3 or 4 main divisions, like blood cupping or wet cupping, dry cupping, slight cupping, point cupping, and scraping therapy, which is called gua sha in Chinese. Another therapy which is so effective for old ages, babies going to the elderly, is the massage therapy called tuina in Chinese. It also has so many divisions and specialties. When we want to put the difference between Western medicine and Chinese medicine into an example, we can talk about common cold. When we are approaching a common cold patient in Western medicine, the main thing for us is given medicine to stand against cough, against sneezing, dry nose, dry throat. But we don't go directly to the root of the problem itself, which is in Chinese medicine the cold or the heat that caused the common cold. So we attack the main source, so we reach the point of symptoms wiping away. That's exactly the difference between Western medicine and Chinese medicine as an approach, put in a small example. Usually Chinese medicine is used in chronic diseases more than using in acute cases or emergency cases. Emergency cases, acute cases, they go directly to Western medicine. In Chinese medicine, the approach of chronic diseases will make the patient eventually as close to the health state as possible. Not like Western medicine, when approach chronic disease patient, it's gonna make the patient exhausted at the end of the treatment, and that's so clear to the naked eye once the patient is done with the treatment.